Today I'm speaking with Hannah Mason, who has just published the article Comparing Rural Traffic Safety in Canada and Australia, a scoping review of the literature in rural and remote health. Congratulations, Hannah, and welcome.
Thank you very much.
It's great to be speaking with you today. I can't wait to hear about your research. Could we maybe start with a bit of an introduction to the research team?
Yeah, absolutely. I'm Hannah Mason. I'm originally from Canada and I came to James Cook University in Townsville, Queensland in Northern Australia for my postgraduate studies. And there I met Richard Franklin and Peter Leggett, who are JCU professors. And they're also co-directors for the World Safety Organization Collaborating Center for Injury Prevention and Safety Promotion. So they were definitely the right people to come across. And we also got to collaborate with Don Boyklander and Jason Randall, who worked at the University of Alberta, and they're also safety research experts there in Alberta, Canada.
Fantastic. And why this topic? How did this research come about?
So I noticed a lot of similarities anecdotally when just like listening to the news segments at night about rural crashes that were fatal. It's a very similar scene when you watch the 6 o'clock news in Canada versus Australia, other than the accents, of course. So I wanted to know if the rates were similar and if they were using different prevention strategies, if the issues were the same, because there's a lot of geographical and sociocultural similarities between our countries. So I connected with Richard, who's an expert, as I said, and we started to develop the project.
Brilliant. So, what did you find down to the juicy details?
Yeah, so we found 43 papers that were either Canadian or Australian that explored this topic, and we undertook a meta-analysis which told us that for people who are living in rural areas, they're 3.2 times more likely to die in a motor vehicle collision in
Wow.
compared to those who live in big cities, metropolitan. And there was a lot of similarities in terms of the risk factors as well for these fatal collisions. And those were drugs and alcohol, speed, and driver error. And then we also found that the prevention activities and recommendations across the literature were quite similar as well. Most of them were around improved infrastructure, vehicle design, impaired driving prevention, and then also education for drivers.
Right. So, what needs to happen next? What are the implications of this research?
So rural road fatalities are really complex. They occur on roads they have fast speed limits. People are driving for a lot longer distances. The road conditions are typically not as great, and there's lower resourced health services, and it's a greater distance for high-level trauma centers to get to. So the context is really important, and it's very different than in major cities. So the prevention strategies also have to be different. For example, when you think about things like driving under the influence, rural drinking more often happens at someone's home rather than a licensed venue. So there's less supervision. There's also less options for getting home safely, like taxis and rideshare. So what we need is a dedicated rural road safety research center in the rural context so that they can clearly understand it and integrate that into a research or into their research rather than rural research being undertaken in the city where we don't know as much about it. Yeah, and so we need some targeted investment. We need dedicated resources to address the issue, and we need to improve, obviously, the rural trauma care to prevent further fatalities.
Yeah, fantastic. It sounds like a huge issue, so it's great to get a light shone on it.
Thank you so much. Yeah, it was a very eye-opening study and definitely something that we need to pay more attention to.
Sure. Well, thanks very much, Hannah. That's wonderful.
Thank you. Thanks, Melissa.